pleased to be here in Bona Dea Hospital. This is one of the biggest hospitals with the most excellent facilities for complex cardiac interventions of the area. And I'm pleased to be here as a former president of the European Society on Complex CTO and Lesions interventions. And I'm pleased to say that in this hospital, of course, there are many facilities that can be ready for developing these interventions in coronary artery disease. Part of coronary artery disease, acute myocardial infarction, left main bifurcation and chronic total occlusions, we can treat also percutaneously mitral valve repaired by the mitral clip, and also transaortic valve implantations, TAVI, which is nowadays one of the most recent conquerors of the interventional cardiology. This center is going to be a center which will attract not only Azerbaijan people, but also people coming from around the area around Azerbaijan, and this will of course be a center where tourism will also health tourism from the area around will be of course a very important penetration. I'm sure that this center, together with the Azerbaijan doctors, will become an excellent center for future, and especially in interventional cardiology.
I am proudly announced that in Bona Dea Hospital we will build and establish the first primary stroke center for the treatment of the patient with the acute stroke. As you know, the stroke is a medical disaster, and the first time in Azerbaijan we will have opportunity to treat the patients to reduce the mortality and disability, as well aggressively provide the treatment for risk factors to treat and to prevent the stroke. It's my great pleasure to inform the public that the stroke center will be established in Bona Dea Hospital, and I believe that the Bona Dea Hospital will become the core from which will stroke system spread across the country.
I'm more pleased to be able to work here in Bona Dea together with 9 other orthopedic colleagues from Belgium who will cover all pathologies, and in such a way that we can improve together with Azerbaijan medical doctors and orthopedic surgeons the care of the people of Azerbaijan. And Bona Dea has also the intention to cover with exceptional care the region and be able to have patients join for care here at Bona Dea, and the most specifically in my domain, the orthopedic surgery. Orthopedics has developed over the years, has become arthroscopic, has become endoscopic, has become robotic, and we are less and less aggressive. We can do more and more surgeries with good results in day clinic care without having the patient being or having to stay in the hospital. We also cover rehabilitation, and as you may understand, orthopedics without rehabilitation does not provide excellent results. So we care about rehabilitation as well in our locomotor pathology.
With a special interest in digital microscopy, as such, I was co-founder of a company called Argoco. Argoco has developed a platform for exchange of digital pathology images, and we are very happy to work together with Bona Dea Hospital. This is a special opportunity for us to have biopsy review as a part of our service that we can offer to Bona Dea Hospital. We are very delighted with the quality of what we have seen here let me state it like this. This is a state-of-the-art building, and we've seen the first round of the pathology lab, which I think is really state-of-the-art infrastructure. So we are very happy to be able to work together with Bona Dea Hospital.
Neurosurgery is about surgical treatment of problems which are very important, like stroke, head injury, or other pathologies like Parkinson's disease or Alzheimer's. Neurosurgery is a very technological specialty. It is very important to have precision. I'm very proud to work with Bona Dea Hospital because it has the highest technology possible to treat neurosurgical problems. It is very important to have good diagnostic procedures like the magnetic resonance system we have here. It is important to have good tools to do operations which can be less and less invasive, and it is important also to bring new technologies like deep brain stimulation. The equipment and the personnel here is top grade because it is an international team with an ambition to have a big excellence in their work. I look forward to solve any problem related to neurosurgery you may have in this hospital, Bona Dea.
I had the opportunity to be present at the official opening of this impressive Bona Dea International Hospital. At the University Hospital in Brussels, we have already a long history of accreditation of the lab activities. First, a Belgian accreditation, but since last year, we achieved the GCI accreditation with the highest qualification. Also last year, we started a collaboration with the International Bona Dea Hospital. In that collaboration, we focus in bringing the high standards from the University Hospital Brussels to Baku, to the Bona Dea Hospital. We want to do this by improving processes, optimizing these processes, reducing the response time, and also introducing new technologies, of course always with the highest level of quality. In that way, we think, we hope, and we are sure about it, that the Bona Dea International Hospital will achieve the GCI accreditation very soon.
I'm currently starting a new position with this hospital. My new position will be the Chief Operating and Quality Officer for this hospital. I'll be responsible for all operations of the hospital, including medical and administrative. I will also be responsible for taking this hospital and preparing this hospital for international accreditation, hopefully Joint Commission international accreditation. And that will happen probably soon, right after the opening the actual operation of the hospital. I will also be advising I'm the senior advisor to the board of directors of this hospital, and I will hopefully be providing advice as it relates to the quality and performance and the operation of this hospital in the years to come. Before I came to this hospital, I was the executive director of the American Institute for Healthcare Quality. I was a professor at the University of Oklahoma, and I'm also a medical doctor. I'm a medical doctor in pulmonology with training in London and the United States. Having said that, my first impression of this hospital was always good. I visited this hospital about a month ago, and it was in preparation to join this hospital as the Chief Operating Officer. And whenever I visited this hospital at that time and now, there's a major change, major improvement. I can see that this hospital is one of the leading hospitals that I have visited throughout my life. I have worked in and visited several hospitals in different countries around the world. I have always worked around hospitals. So comparing this hospital to the hospitals that I have been, it's a very positive experience, very positive comparison. This hospital has a lot to offer. I can see that in years to come, this hospital probably will be not only one of the leading hospitals in Azerbaijan, but probably a leading hospital in the region. This hospital has the potential to reach out and achieve marvelous outcomes. It's well equipped. Some of the equipments that this hospital has are state-of-the-art, one of the best in the world. This hospital is also well constructed. If you look at the design of the hospital, it's one of the modern and most contemporary designs, but it is so designed patient-friendly that makes the patient use this facility in an easy and most effective way possible. I can see that the outpatient facilities is one of the best. Patients can be seen by the doctor after being registered, and the registration process and all the other activities is all automated. The medical record is all online, automated, electronic medical records. I can see that patients will also receive some of the best care, and I can see that this hospital continuously improve and continuously achieve what the objective of this hospital is all about. So maybe I hope that the next time we meet, maybe in a year or less, this hospital will be accredited and will be one of the leading international hospitals in the region. I hope that you can come and visit the hospital and enjoy the services that we do.